So hi, I'm Priscin. I'm a fourth year pharmacy student, so my final year of my degree at University of New England. Coming to Sri Lanka, we had a few ideas of what pharmacists do, and it's a very different role here in Sri Lanka than it is in Australia. But we found that a lot of the things that a pharmacist does in Australia is being taken over by other roles such as nursing and the Ministry of Health officers. So it's good to see that the roles that the pharmacist has in Australia hasn't been forgotten, it's just been redistributed to other people. We found that the idea of having free healthcare here is great, and it comes with its own challenges and things like that that we have witnessed. But especially from a pharmacy perspective, having free medication for everyone is amazing. In Australia, it comes at a subsidised cost for most people, and for certain people who are eligible, they get it for free. And even that is causing a lot of commotion and things like that in Australia, and people are trying to, get rid of funds and things like that for that. But I think it's really important to maintain having sort of a subsidised system as we do in Australia. But the fact that you guys have it for free is amazing. I've noticed that the role of the pharmacist here is to be mainly a distributor of medicines, whereas in Australia it's a more holistic approach with looking at sort of patient concerns, patient welfare, and it's very patient-centred, everything the pharmacist does. And often at times you find that patients are more comfortable talking to a pharmacist than they are to their nurse or their doctor about some of their medication problems. And in Australia we work as a multidisciplinary team, so if the patient's addressing any concerns that they have about their medications to us, we then pass those concerns on to the doctors and the specialists that they are dealing with. We also found that it was great to see the traditional Ayurvedic treatments here. It's something that's not really present in Australia. And so it was great to see that there is a mix of having both the traditional treatments as well as Western medication.
One of the biggest things I noticed was the sense of community. Everyone's willing to do that little bit more to help other people. We saw it in the hospitals and the eye clinic. Everything's a little bit rushed, and whereas here everyone was quite patient and willing to wait to get their turn, especially in the waiting rooms at the hospital. I mean, we see nothing like that at home. Everyone's really demanding and wants their treatment now, but people here to sit quietly and they're kind of to themselves or happy to talk to the people beside them, but it's definitely not as demanding as in Australia. The sense of community was also wonderful. We saw children playing cricket in the streets and people were just joining in when they wanted, whereas at home that definitely doesn't happen. So it was definitely wonderful to see such a coherent group of people working together to make Sri Lanka the best place it can possibly be.
Okay, hi, I'm Natasha. I'm a second year biomedical science student at University of New England in Australia. I've come to Sri Lanka here as a part of the New Colombo plan, and I've had a really amazing time. I've seen a lot of really new things and had a lot of new experiences. So I'll just briefly talk about a couple of the things that I found most interesting. Probably my favorite thing to see was I really like the lab. So to go and to see the differences in the labs in Sri Lanka as opposed to Australia, and the different procedures and policies surrounding that was really exciting. One thing in particular that stands out for me was when we went to visit some of the labs at MRI, we had to take our shoes off to go into the lab, which in Australia you would never ever do. They would be quite upset if you were walking around barefoot in the lab. Another thing that stood out to me was the Ayurvedic Eye Center. I think that the traditional medicines that are used there are fascinating and something that I would personally be interested in learning a lot more about, sort of active ingredients and things like that in the herbs that are used. The sense of community there was incredible as well. I think sometimes in Australia, because of the amount of procedure and rules and regulations, things can become a little less personal. So it was quite nice to see everyone sort of banding together and interacting there as a community. And then the final thing I'd like to say is IIHS seems to have a lot of research opportunities for students, which I found really amazing. That's not something that we get to experience in Australia. Really, if you wanted to do research, you would have to do it after your degree is finished, but not really during your degree at all. So I found it to be a really great learning experience.
Okay. Hi, my name's Greg Bracken. I'm studying biomedical science. The main area of interest while I've been in Sri Lanka was to look at infectious disease, see what the main problems are here and how they're managed, and of course the main one being dengue fever. So when we went to the Medical Research Institute, we looked at the entomology unit there where they're breeding mosquitoes, studying the efficacy of insect repellents and chemical controls, seeing that can reduce the spread of dengue. So we don't really do, this unit we're doing as a part of visiting Sri Lanka constitutes a research project, and we'll have to write a report based on what we've seen here and go further and do literature reviews on what we've seen. So it might be something like the IIHS Centre where we could research the plants they used in their preparations and prepare a report based on that and do literature reviews on that.
So I'm Lizzie from University of New England. I'm in my third year of biomedical science there. My time in Sri Lanka has been amazing. I've really enjoyed it. Having the opportunity to see a different healthcare system to that in Australia, which is very different, and also being able to experience the culture, which is also very different from Australia. Some things that I've really enjoyed here is the food. The food is quite nice. I do enjoy curry. I've tried some of the local fruits. Some have been really nice, some haven't. The healthcare system is very different to Australia's with no referral system. That's like a really big thing in Australia. You have to see your GP before you can go to a specialist or anything. There's nothing like that in Sri Lanka that we've seen, which is strange for me and for the rest of the students as well. The laboratories in the hospitals and things that we've been to have been quite understaffed. They've said to us that they all seem to work smoothly, and there didn't seem to be a backlog of any samples, which we do get in a lot of the city hospitals in Australia, despite having adequate staffing.
Okay. Hi, my name's Dr. Robert Hart. I'm a lecturer at the University of New England, and typically I teach into subjects that include physiology because that's where my background lies. So we've come to Sri Lanka for a bit under a week, basically, to this point. And what we've been doing is visiting a series of hospitals and dispensaries, as well as some traditional medicine treatment facilities. And our students have basically been there to observe the differences between the healthcare systems you'd see in Sri Lanka and Australia. And I think that some of the things that really stood out for our students were that we could see that there's a strong patient focus and a strong efficiency, particularly within the laboratories seen in Sri Lanka, that you might not necessarily see in Australia. One thing that stood out for quite a number of us was that the time to wait to see a doctor, say in a hospital, was relatively short compared with what you might find in Australia. So some of the hospital directors were saying that they would expect a patient to be in and out within an hour, in most cases maybe 2 hours, when it's particularly busy. Whereas in Australia, I can remember from my own experience when I had a broken arm, I had about 6-hour waits until I had an x-ray, and then another 2-hour wait before I got a cast applied. Some of the other things that really struck us were the focus on preventative medicine. So particularly myself, I noticed that there's a strong focus on maternal health and family planning. And this was maybe just a bit of a surprise for quite a number of us, given that we didn't have much of an idea about the Sri Lankan healthcare system. And I thought this was a good way for Sri Lanka to actually spend its resources where it should get a really good payoff. In that, in several years, I would expect that you'd see relief in the healthcare system by preventing people from getting sick and having to use those facilities later on. For our pharmacy students, I think they found that their perception of the role of a pharmacist was quite different from what you would see in Sri Lanka, in that they have a role with counselling patients, particularly how to take their their medications, storage, and so on and so forth. Whereas here, it seems that the dispensers would simply hand out the medications that are listed on the prescription, and the educational component would be more a part of a nurse's role or a matron's role, perhaps. So those are probably the major differences that I think stood out for our students between the two different healthcare systems. And I think it's just been a great trip for all of us to actually see a part of the worlds that we might not necessarily see. I've quite enjoyed the hospitality I've encountered. Most of the people we've met have been really open, friendly, quite happy to talk with us, ask questions about where we're from, what we do, talk about Shane Warne or Michael Hussey, some other cricketer. So I think it's really good that we have that shared culture, even if it is just cricket and sport. But I think it makes it a lot easier for us to interact with local people because we've just got that icebreaker where we can start interacting quite easily with that.
So I have been lucky enough to have a second visit to IIHS. We've brought a different group of students this year and had a few different experiences from our first visit. I think one of the most valuable things that our students were able to see and observe was some of the traditional Ayurvedic medicine. That was a really unique experience that we could have here in Sri Lanka. One of the other real strengths, I think, at IIHS is the research focus. It was very, very valuable for our undergraduate students to see the students at IIHS participating in research and presenting this research so confidently, and the fact that they're presenting this research internationally. That's something that our students don't really have at the moment, and I think as a lecturer that's something I would really like to give my students, that sort of experience. And I think observing that and seeing the confidence and the maturity that the students at IIHS have, that's something that our students can really learn from. I think a really valuable experience for our students coming to Sri Lanka too is observing the health system and observing the difficulties that are faced by this country. It really gives them an appreciation of how much they have at home, and I think that changes their outlook basically on their whole life and makes them approach their studies differently when they get back home. It's a real eye-opener and a real life-changing experience for students to come to a country like Sri Lanka.
Hi, my name's Sam and I study pharmacy at the University of New England, and it's in Australia, in Armidale, tiny little town. And pharmacy in Australia is slightly different to what it is here in Sri Lanka, and I think that has been the main point that I have gotten out of this trip. This whole trip has been fabulous. The country is beautiful, the people are lovely, and the hospitals are very, very different. I've noticed that here in Sri Lanka, pharmacy is mainly distribution. Back in Australia, as a pharmacist, I'm a primary healthcare provider. I'm in constant contact with patients, I assess their medications, I educate patients on their conditions, their medications. I educate GPs, other health professionals about medications and conditions. I get to talk to people and interact in an interdisciplinary team, both in the pharmacy in a hospital and in the community. And I was very, very surprised, very shocked when I came here and I was asking them questions like, oh, so how do you conduct ward rounds and see patients when there's so many patients? And they just kind of looked at me like, what is she talking about? Like, what? So then that's when I really found out that pharmacy here is distribution. But despite it being very different, the healthcare is still quite well provided, and a lot of the duties that a pharmacist back home would do have just been passed on to other professionals here, and it's been lovely to see that nurses have taken on a lot of those roles and can do that, and I've just loved every second of being here. It's been fabulous.
Hi, I'm Mel. I'm a biomedical student from UNE. Over the last 7 days, we've had just an amazing trip through the whole of Sri Lanka. We went down to Galle. We saw a few of the hospitals in Colombo. What amazed us most was the hospitality of the people. Everywhere we went, we were just treated like queens and kings. We were like superstars, really. It was just amazing. One of the highlights for me was the but I can't say the name. The eye centre, the herbs that they use there, and again, it was a people focus for me. It was just the way that the people got in and just did as they needed to. There was a shortage of nurses, a shortage of doctors, but even the patients were involved with preparing the treatments and giving out the eye treatments and everything. So yeah, for me that was a highlight. I could have stayed there and helped with the preparation all day. I just thought it was really good fun. We went down to Gaul, and down there we were treated like superstars again. We had a really lovely hotel that we stayed at. We ate some fantastic food. The only thing is I get a little bit frightened about dogs. So the amount of stray dogs that you have in your country just worries me a little bit. I actually went to the beach one day and went for a walk, and I had like 10 dogs following me, and it was just a little bit of a scary experience. But apart from that, I wasn't even that scared about that. It was just something that I can talk about. So yeah, I had an amazing time. Thank you very much, guys, for hosting us, and it was just an amazing opportunity that would never have come up. So that's fantastic. Thank you very much.